Welcome everyone to today's webinar. I'm Gabrielle Mason with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your Q&A box you see on your screen. We look forward to hearing from you. This session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it's my pleasure to start today's webinar by introducing our presenter, Mary Beth, OneSource Document Database Dental Consultant and Office-Based Surgery Consultant, RDH ICP OSHA Outreach Trainer. Mary Beth has consulted with hospitals, clinics, and many dental and healthcare practices around the U.S. regarding the necessary infection control and compliance programs mandated in each of their particular private practices. She has over 20 years experience teaching OSHA regulatory requirements and has assisted these professionals in standing operating procedures to meet the federal, state, and local requirements. Disclosure. As a consultant, she has received an honorarium from OneSource and Becker's Dental for the development and presentation of this webinar. No other relevant financial or non-financial disclosures exist. She would also like to acknowledge OneSource and Becker's for their continued support in dentistry. At this time, I am pleased to turn the floor over to Mary Beth to begin today's presentation.
Thank you, Gabrielle, for that kind introduction. So on your screen, I put this collage together to make a point. If the National Weather Advisory was to forecast that an extreme weather system was heading towards the United States, we would all take the steps necessary to prepare our families and our environment. Depending on where you live in the country, you could expect maybe snow or flooding, a hurricane, or even a tornado. You could identify the threat to the region you live in and plan accordingly. You would confirm an evacuation route. You would stock up on needed supplies, food, batteries, generators, and you would fully charge your phones and computers. You would have a radio to stay tuned to the latest information on the storm. Eventually, you would see changes in the sky, feel temperatures drop, hear and feel strong winds, and you would be prepared because this was forecasted. But what if the approaching storm can't be seen, can't be felt, and worse, there is no forecast? This is exactly what happened when our recent storm, identified as virus COVID-19, hit the United States back in January, a virus that spreads easier than the common flu. The transmission occurs when people are in close contact through airborne particles and touching contaminated contact surfaces. What is even more concerning, people can be asymptomatic and still be carrying the virus that can infect others. These are certainly unprecedented times, and this crisis has created much public fear. People need and want answers. They expect direction for protection. They need correct and reliable sources of information, and they absolutely need and want updates. Perhaps a positive outcome of COVID-19 has been the public's heightened awareness of the value of their health. Public knowledge grew rapidly, learning in a very short amount of time globally about exposures, infection control, environmental cleaning, social distancing, and personal protective equipment. Of course, healthcare was at the front line, facing this extreme challenge. The people who work in healthcare are real heroes. Not only were they the caregivers of the very sick, but they needed to provide education to patients, loved ones, and the community on the need to understand and adhere to CDC guidelines, all the while putting their own personal health and safety at risk. Today, I want to direct your focus on the infrastructure of healthcare. That is, it's the policies and procedures that are in place that provide the healthcare guidelines and processes in order to achieve efficient and effective results. During this crisis, these processes have been tested, confronted, measured, and adjusted in order to fight this invisible storm. Oversight agencies provide us with those standards and guidelines that are based on scientific, best evidence processes. And it is only with the concerted efforts of oversight agencies, healthcare workers executing these guidelines, and continued communication to the community that we are able to adjust in extreme circumstances. This is the basic timeline for COVID-19. Although we are now in phase 2, we are still knee-deep in this pandemic, as Dr. Fauci from the CDC stated last week. In fact, many states, as we all know, are seeing a spike in the virus. Dr. Scott Gottlieb has presented a general look at what we can expect from each phase. Please note on the screen that phase 3 was in hopes of a vaccination. The FDA and other agencies are working tirelessly to find a vaccination. Why? Because vaccinations are one of our greatest defenses against illnesses and diseases. This is now the new norm. Again, right now, we do not have a vaccination and no evidence-based therapeutics that can help mitigate the risk of spread or reduce serious outcomes in those with infection. But what we do have are public health measures of social distancing, masks, and cleaning hands and environment. So we are now in phase 2. As our dental offices resume, how can we ensure a culture of health and safety in our dental offices? Where do we go from here? What does this look like, and what are the key considerations? The first key consideration is recognizing the need and the importance of oversight agencies in dentistry. They provide the required or mandated compliance regulations and recommendations. Professional associations also assist us in providing these additional recommendations and guidelines for scientific best evidence processes. Mandated versus recommended. This has been the new language during the COVID crisis. Unfortunately, it has become more of a political issue or statement. But for today, for dentistry, you need to understand making certain of safety and health in our dental practices is mandated. You are required to provide a safe and healthy practice environment. I can't say that strongly enough. The mandated standards for dentistry are scientific, best evidence-based practices. This is defined as evidence-based practice is research-based practice that has been shown effective through rigorous scientific evaluation and data. The ADA put out for dental offices a toolkit for reopening, and the CDC also put out recommendations to assist you in this process. These are some of the additional recommendations. Remember, these oversight agencies have been providing guidelines based on scientific best evidence practices for years. These additional recommendations are the amplified version of mandated regulations you should already have in your dental practice. New thinking, new attitude, and some new ways of working. Are you prepared? There is going to be change. Patients will want validation because patients have increased knowledge. And how are you easing the feelings of tension with your staff? You should have efficient, effective, and measurable programs. But do you? Dental office oversight is not as stringent as hospitals. Healthcare professionals, particularly those in medical and dental professional offices that are not accredited or CMS certified, have received limited formal pre-service training with an on-the-job training that may be minimal or incomplete. For many medical dental professionals, annual OSHA-mandated bloodborne pathogen and hazard communication training may represent their only exposure to formal continuing education addressing infection control issues. The Joint Commission, AAAHC, and Quad-ASF, as well as CMS, are oversight agencies. They make frequent visits to hospitals, clinics, and other healthcare entities to confirm that the standards and regulations are in place with validated data showing measurable results. Accreditation means that staff has made an extra effort to review and improve the key areas that can affect the quality and safety of care. You may have heard of hospitals seeking to achieve the gold seal of approval from these accreditation agencies. This means they have the processes in place that are efficient and effective and measurable and are providing the highest standard of care. Hospitals manage their processes and therefore can adjust to improve and control outcomes. It's called quality assurance. Because hospitals manage their programs, they can test for success and failures, gather all that data, and then they're able to make good decisions as to what adjustments are needed and how they can improve the processes to better accommodate healthcare needs. When performed consistently, it becomes a standard of care. Unfortunately, most dental offices are not put through that kind of a rigorous inspection with accreditation agencies and perhaps do not know how to achieve this standard of care. But it can be done, and I'm going to show you. Letting go, maybe you need to let go of old ways. So let's look at our practices and take the opportunity to become our best. Change can cause stress, we all know that, but it can also create excitement. So let's take this energy and embrace change and create efficient, effective, and manageable processes that will assist us in achieving a gold standard of care. It is a great opportunity right now to implement lasting change with evidence-based best practices. So let's start at the beginning. Start with an analysis of your practice. Take a new look at your office. Identify what you are exposed to. These are the physical, biological, chemical, and environmental exposures that are in all of our dental practices. Each individual office will be unique. It varies by procedures performed, products used, types of equipment, and the environment you are practicing in. Again, it's called the analysis of your practice. What are you exposed to? Next, we look at the importance of oversight agencies in dentistry that create the mandated compliance regulations that require you to identify all exposures in your office that can affect staff, patients, and community. The two main agencies are OSHA and CDC. So let's start with OSHA. The OSHA Act was established in 1970 under President Nixon. The Act was developed to protect the health and welfare of all employees. OSHA is required by law to be in every dental practice. It is a written program to be reviewed yearly upon new hire and if there is a change in product, procedure, or equipment. As an FYI, I think COVID-19 may have provoked the awakening of this giant OSHA because, again, OSHA is concerned with the safety and health of American workers. Today, with coronavirus, we really need to focus on the health and safety of our essential workers. Now, the CDC. Unlike OSHA, the CDC protects all people, not just workers. In the mid-'80s, the CDC recognized that the dangers of exposures in dentistry were not just affecting workers, but patients as well. So these two agencies, in cooperation with other professional organizations and federal agencies, created the mandated guidelines to provide us with the safest and healthiest dental practices. Again, back to basics. Epidemiology, the study of the causes, occurrence, and distribution and control of diseases. As you know, break one of these chains and you've stopped the transmission process. So let's review modes of transmission for dentistry. How are you getting exposed? This screen shows the biological exposures in dentistry: direct contact with blood or body fluid, indirect contact with a contaminated instrument or surface, contact of mucosa of the eyes, nose, or mouth with droplets of spatter, and inhalation of airborne microorganisms. Now, if you take a look at the modes of transmission for COVID-19 that are on the screen, do these look familiar? Hence, we have the heightened guidelines in the ADA toolkit and the CDC recommendations for interim reopening guidance for dental settings. Again, these are amplified recommendations for the standards that should already be in place in your dental practice. OSHA demands that you protect employees. CDC demands you protect the public. OSHA components are mandatory, not optional. Again, these pieces should already be in your practice. The two primary standards of OSHA that apply to dentistry are the bloodborne pathogen standard and the hazard communication standard. Note, the key provision of the bloodborne pathogen standard is the exposure control plan. That is, the identification and explanation of exposures with tasks performed by employees. This is how we will create the infection control plan and implement the standard precautions and necessary control requirements. Here's a quick summary of the OSHA requirements that you see on the screen. Start with administration. That includes employee record keeping, training, vaccinations. Your OSHA program needs to be in writing. Start by identifying the exposures each person is exposed to and classify tasks as 1, 2, or 3. Keep this in their personnel records. Now, these records are not the dental records. If you are getting cleanings or other dental services in your office, that's your dental record. Personnel records are separate, personal, confidential records for the employer to keep in a private locked cabinet. This record contains such documents as the employee training dates on the compliance programs, history of vaccinations and immunization records, the hepatitis B vaccination that's required of all staff exposed to bloodborne pathogens. These vaccination documents are mandated to be in this personnel record. Always check with your state for any other additional vaccinations required of your staff. And if an employee declines to have a mandated vaccination, there must be a declination form in that record saying that that person has declined to go with the vaccination. It is also required by OSHA to have a policy in place in case of an occupational exposure. Any employee who does have an occupational exposure, that recorded incident is kept in the personnel record. Now I'll skip down to hazard communication standard because we just went through the bloodborne pathogen standards, your exposure control plan. The hazard communication standard addresses the chemicals used, labels required, safety data sheets, classification of chemicals, information, and training. You are required to create a hazard communication program. Refer to your analysis, your office analysis that we just discussed. This standard addresses the possible chemical exposures in your office and how you are communicating the information to employees. It includes having a provision for identifying the hazardous chemicals, who is at risk to exposures, the correct updated pictogram labels for these hazards, and training of your employees. You must list all the chemicals used in the practice and identify the ingredients, hazards, and emergency procedures associated with each one. Create a chemical inventory list, and you must have the corresponding safety data sheets, an SDS, for each chemical in your practice. Another hazard that should be identified in your office analysis and exposure control plan are environmental hazards. An example is, how are you handling hazardous waste? Hazardous waste can be biological, chemical, physical like sharpies, or a combination of any of these. And lastly, on the bottom line, the general safety. At this time, OSHA does not have a specific standard, but has a general duty clause. It states that it is the general duty of the employer to provide to all staff a safe and healthy environment in which to practice in. So the layout of your office and the equipment you use can present certain physical hazards. The X-ray machines and lasers can create hazards. Are there exits and non-exits clearly labeled? There are electrical considerations. Do you have an emergency escape plan, a fire evacuation plan? These are just some examples. There are others, but they can all present physical hazards, and you are required to identify them in your office by OSHA standards. This is how you create your mandated exposure control plan. It's like completing a puzzle. Each of these pieces of the required compliance standards interlock and fit together. OSHA and CDC are concerned with the biological, chemical, physical, and environmental exposures in your office and the measures taken to protect the staff and patients. I put this again, the bloodborne pathogen and hazard communication standards are the two main standards of OSHA required in dentistry. These OSHA components ensure a safe and healthy dental practice for staff. Training is required yearly upon hire and if there's a change in product, procedure, or equipment. At the end of the diagram on the screen is the infection control plan. This also needs to be in writing, but once you have determined your core exposure control plan, then you have the pieces already in place to develop that infection control plan. Checklist of mandated expectations. Here is a basic checklist of compliance requirements. I've grouped them in categories. To reiterate, you are mandated to have your programs in writing, identify what your staff is exposed to, biological, chemical, physical, and environmental hazards. How are you controlling these exposures? Identify standard precautions in your engineering and work controls. What are your established processes? Confirmation that all your staff understands the processes because they have had comprehensive training. And lastly, you should have the ability to measure how it's all working. Implementing your checklist and closing the gaps. It's not enough to just have a checklist in your practice and not actually implement all these requirements. In other words, having an OSHA book on a shelf in the corner or a checklist included with that book doesn't prove or verify that you have an established, working, measurable process in your office. So, how are you doing this? Let me show you. Start by defining your processes. This requires standard operating procedures, SOP. A standard operating procedure, or SOP, is a set of step-by-step instructions created by a business to help workers carry out routine operations or processes. Their purpose is to achieve efficiency, quality output, and uniformity of performance while reducing miscommunication and failure to comply to industry regulations. SOPs are a must for any program. So why standard operating procedures? It allows you to define and standardize each process. You can't fix or improve a process if it's not standardized and in control. Standardized tells where the process is, where it's going, and how it's getting there. Standardized enhances consistency. Standardized processes provide the baseline for continuous improvement activities. You can't manage what you can't measure. Standard operating procedures allow for efficient, effective, and consistent processes. So let's apply SOPs to dentistry. Standard operating procedures are a team effort. That means this involves the entire office. Let's start by taking the mandated OSHA and CDC regulations and write an SOP for each of them. OSHA, CDC, OSAP, and OneSource are excellent resources for the information you are going to need. Each staff member takes one SOP. Clinical staff takes the clinical SOP, and the administration staff takes records or written requirements. As you see here, this is a breakdown of requirements. So at the top, start with OSHA. It's your exposure control plan. It's written. Again, identify the exposures in your office by doing the analysis of the biological, chemical, physical, and environmental hazards. Next, engineering controls. What are the systems in place for protecting yourself from exposures? These are your standard precautions, work practice controls, and engineering controls. OSHA and CDC require an infection control program in your office. This is a list of just some of the fundamental elements of an infection control program. An SOP is required of each of them in order to create a standard that can be managed and measured. OSAP and CDC are good resources for additional infection control protocols. So again, a standard operating procedure, or SOP, is a set of step-by-step instructions created by your dental office to help your staff to carry out routine operations. Their purpose is to achieve efficiency, quality output, and uniformity of performance while reducing miscommunication and failure to comply to industry regulations. These are the 7 steps to creating an SOP. It begins with a very detailed description in writing. It includes diagrams, explanations, demonstrations, observations, audits, and then finally a follow-up and discussion. I will break it all down. So let's do an example. Let's say sterilization of instruments and reprocessing. Step 1 is a written instruction. Begin with a detailed written description of this process done by the persons who perform this task most routinely. Use checklists to confirm each detail is covered and create uniformity. Description must include the manufacturer's instructions for use, IFUs. A great resource for these documents is OneSource. I want to take a minute right here to discuss the importance of the IFU and SDS documents so you have a clear understanding of why you need these. On this slide is a sample of an IFU and a safety data sheet from OneSource. If you don't have these documents in your practice, you need to get them. OneSource is a company that provides a library of instruction for use and safety data sheets. Both of these documents are critical for the safety and health of your dental office. Let's start with the safety data sheet, SDS. Most of you are aware that your dental office needs to have a physical copy of your safety data sheets. Under the Hazard Communication Standards, employees have the right to know the identities of the chemicals known to be present while working, as well as their hazards and what protective measures are available and should be provided to you to prevent adverse effects from occurring. The SDSs have detailed information concerning the chemical and provides all needed detailed information, including but not limited to exposure controls, personal protection requirements, and identity of the hazard. The employer must have an SDS for each hazardous chemical in the office. Employers must ensure that SDSs are readily available to employees. You are also required by law to include in the written exposure control plan those chemicals employees are exposed to. This plan again needs to be reviewed yearly and whenever there's a change in a task or procedure. Again, go back to your chemical exposures in the office analysis that created the exposure control plan. You can contact OneSource to obtain any SDS documentation that you are required to have for your chemical inventory list. Now let's talk about the manufacturer's instructions or instructions for use on the left. In order to begin creating a standard operating procedure, you first have to put the process in writing. Don't put an inaccurate process in writing. Confirm with the manufacturer's instructions that you are processing and caring for instruments and equipment correctly. The reason IFUs, or manufacturer's instructions for use, are needed is because these instructions are in accordance with the FDA, the Food and Drug Administration, and the AAMI, that's the Association for Advancement of Medical Instrumentation. These agencies confirm that the manufacturer of each device has validated the steps necessary to prepare a device for the safety of patient use. The FDA and AAMI are the oversight agencies that confirm that the guidelines are met to use the device or equipment safely. Dental healthcare professionals are not equipped to validate these guidelines. Users of the equipment must depend upon manufacturer for a validated IFU. So if you have sterilized instruments the same way for 15 years, get the manufacturer's instructions, IFU, and use it as a means of checks and balances. Maybe you were trained by someone who didn't do it properly or correctly. You don't know that unless you take this step, get the IFU, and verify you are doing the process consistently correct. In our example of sterilizing of instruments and reprocessing, the IFUs provide instruction by the manufacturer of the device that states what is needed to properly process this device. Patient safety in dentistry requires properly processed instruments. Instruments not properly processed puts patients as well as staff's health and safety at risk. The IFU describes the necessary process for cleaning, testing for function, packaging, and the correct disinfection and sterilization process. IFUs will explain if disassembly is required or that a hinged instrument needs to be opened to be sterilized. IFUs define the required maintenance and care of dental equipment and the proper use of your equipment. Both of these documents, SDSs and IFUs, are critical for the safety and health of your dental office. There is no excuse not to have this pertinent information. Again, if you don't have them, OneSource provides a library of these documents. Keep all these documents updated and with your safety and health program in your office. So continuing on, so back to the first step of writing an SOP. Here's our example of sterilization of equipment and reprocessing. In the written details of step 1, you need to be very organized, detailed, and complete. This does take some time. Use your IFU and checklist to help yourself to not forget any of the necessary steps needed to complete your process. If the person who does this process routinely is responsible for completing this SOP, it can be done much easier. This is a great way to confirm that your process is up to date and accurate. This is also how we create consistency in our offices. Don't forget such things as you see on the screen. Single-use devices are discarded and never used for more than one patient. How reusable and semi-critical dental items are cleaned and heat sterilized according to manufacturer's instructions. A step to visually inspect for debris prior to sterilization. An automated cleaning equipment is FDUs. The IFUs discuss the correct use and proper cleaning solutions to be used with these machines. These are just some of the examples, but you need to be that specific and that detailed when writing out the process. Step 2, a diagram of the process. If a picture of the process is available, use it. Use mapping if available. Mapping are the steps to take to complete your process. So it doesn't take like 15 trips back and forth to operatory to cleaning area to do this task. Mapping shows the most efficient process. show the actual cleaning decontamination steps that need to be completed prior to sterilization. A diagram of the inventory needed, as you see on the screen, like pouches, sterilization wrap, biological, mechanical, chemical indicators. A diagram of the sterilizer with the IFU and picture of controls to identify the correct settings that need to be used. Here is a picture of a slow speed. I did this intentionally. As a reminder, in 2016, CDC changed the guidelines. It says, dental handpieces and associated attachments, including low-speed motors and reusable prophylaxis angles, should always be heat sterilized between patients and not high-level or surface disinfected. Studies have shown that their internal surfaces can become contaminated with patient materials during use. If these devices are not properly cleaned and heat sterilized, the next patient may be exposed to potentially infectious material. So which handpieces need to be sterilized? All dental handpieces and other devices not permanently attached to air and water lines of dental units need to be sterilized. If you're not sterilizing your slow speed motors, you're breaching your responsibility to the safety and health of patients and staff. You can't use an unsterilized low-speed handpiece. Step 3, the explanation of SOP by staff person overseeing that SOP. The staff person or the trainer explains to the rest of the office his or her particular standard operating procedure. In this example, it's the sterilization of instruments and reprocessing. You have to explain each step that each person must take to do the process correctly. This is the very detailed instructions and the diagrams done in steps 1 and 2. Validating your process with an explanation of IFU is important. Step 4, the demonstration of SOP by staff person overseeing that SOP. Staff or the trainer demonstrates the correct way of performing the standard operating procedure to the rest of the office. This is physically demonstrating the process. Provide the actual steps needed to efficiently and accurately complete this process. Again, use a checklist and diagrams to create an organized approach to these steps. It will help the rest of the staff to remember the correct process. Then, step 5, observation of other staff persons demonstrating that SOP. Each staff person demonstrates what the trainer explained and performed for his or her particular standard operating procedure. This confirms that all staff is doing it the same way consistently, and all staff have a complete understanding of that process. The staff needs to be able to ask questions so that they can completely understand any changes and or why the process needs to be done a different way. Maybe because the IFU states something different than what was currently being done in your office. The trainer confirms that the SOP was done correctly, completely, and consistently by each staff member. Step 6, then an audit is done. This is a scorecard or a report card. Audits will be done by the trainer sporadically over a set period of time, measuring the success of that SOP being performed. This diagram on this slide is an example of a scorecard. Continue to do periodic audits of SOPs to ensure they are being followed fully and consistently. The comment section is most important because it's not a popularity contest and it's not a bullying exercise. The audit is the trainer's ability to confirm that the process is being followed correctly with each person. If a step is left out or corners are cut, the trainer must indicate this during his audit. It is the only way to have your processes consistent throughout the office and efficient with best practices, demonstrated and then continuously performed. It's a good idea to use your checklist of steps as a worksheet during the audit. It allows the trainer to confirm that each person completed all steps or perhaps where someone is forgetting to do an important step. The trainer can check this step off and describe what was wrong or inconsistent. It will be helpful when you go to discuss the results of your audit. The scorecard on the screen will be the summary of your results. You can use any kind of scorecard or any kind of process that you want. The whole point is to be able to show that each person did it consistently, correctly, and completely. And the last step, follow up. Continue to do audits over a set period of time. Tally up scores at the end of measuring period. Keep all records of audits. This demonstrates that your office is measuring and managing your compliance programs. Discuss results as an office and provide time for communication and discussion for each SOP. You want to be able to discuss what needs to change. What did we learn? How have we improved? Standard operating procedures can go from this to this. Your office will become organized, efficient, and consistent. Always celebrate your success. No matter how small a milestone you make, celebrate the progress your office has achieved towards excellence. Quality improvement means being able to measure our results. What needs to change? What did we learn? How have we improved? You can't manage what you can't measure. SOPs are a must in order to achieve standardization. SOPs provide accuracy and consistency and thereby able to measure and evaluate an effective, efficient, and consistent program. The CDC states program evaluation provides an opportunity to identify and change inappropriate practices, thereby improving the effectiveness of your infection control program. So the CDC expects you to manage and evaluate your processes. Remember, you can't manage what you can't measure. Begin with standard operating procedures for effective, efficient, and consistent programs. Aristotle stated, "We are what we repeatedly do." Excellence, then, is not an act, but a habit. This COVID storm in time will end. Look for a rainbow at the end of the storm. COVID-19 certainly has shown us our vulnerability. Having this opportunity to enhance our dental compliance programs to be more efficient, effective, and consistent and measurable will prepare all of us in dentistry for any storm to come. Thank you for your time. These are my references, and I'm happy to take any questions.
Thank you so much, Mary Beth, for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We will try to get through as many questions as we have time for. So we've received a ton of great questions. So the first one we'll start off with is, does the entire office need to have OSHA training or just clinical staff? And does everyone need to be vaccinated or just clinical staff?
So I get this question a lot, and I get it in every state. Yes, the entire office needs training. OSHA training is required yearly upon hire and if there's a change in product procedure or equipment. OSHA protects all employees, so yes, all employees need training. You need to work together to ensure the office is safe for everyone. Again, everyone has to be trained on what the hazards are in each individual office and how your employer is making your specific office healthy and safe for everyone. There are hazards at the front desk because people who are at the front desk don't think they need OSHA training. But there's hazards everywhere in an office. And the general safety requirements of OSHA require employers to provide employees a safe and healthy place in which to work. But it's also the responsibility as staff to learn the regulations and proper procedures. And what was then the second part was, does everyone need to be vaccinated, did you say?
Yes.
Okay. Vaccinations are required by all employees in the office exposed to bloodborne pathogens. That would be risk classification 1 and 2. So if you work at the front desk and you occasionally jump into the back to help out with instruments, you're considered class 2, and you are required to be vaccinated. OSHA requires all employees exposed to bloodborne pathogens to have the hepatitis B vaccination. Some states even require healthcare workers and dental workers to have the flu vaccination. So always check with your local and state departments of public health and dental boards for updated requirements. And you can also go to the CDC. They have recommendations such as measles, mumps, and rubella, chickenpox, and Tdap, tetanus, diphtheria, and pertussis. Recently added and this is important, all employees who are recently hired need to be screened for tuberculosis, TB, regardless of the risk classification of the setting. In other words, if you're doing insurances or you're at the front, well, if you're at the front desk or even doing insurances or you're just doing whatever in an office in that dental practice and you are just recently hired, you need to be tested for TB. Again, CDC website, there you'll find the current required and recommended immunizations and evaluations and follow-up needed for dental health care personnel.
Thank you so much for clarifying that. Another audience member asks, what if I took an OSHA course at a conference or at another office I used to work in? Can I use that as my OSHA training?
Unfortunately, no. OSHA programs are specific to each office. Perhaps you worked in a pediatric office and now you work with an oral surgeon. The hazards for each office are unique. The biological exposures are similar, but the equipment, instruments, products, and maybe even the chemicals are different. OSHA is specific to each office, and each practice needs to work as a team to develop, sustain, and to be able to improve their OSHA compliance program. That is why all employees of each office require training with their specific office. But your knowledge from previous practices or conferences won't go to waste. You'll be able to help out on your current office or your new office with developing that specific OSHA program. You can offer some real good ideas and insights.
Great, that is very helpful to understand. Another audience member asks, what if our equipment is old or from a previous owner and we don't have the manufacturer instructions? How are we supposed to get that?
Okay, so go to OneSource. They have the library of IFUs. I would also like to ask you, was the previous owner vigilant about cleaning, maintaining, and repairing of this equipment? Did they keep documents of any of this information? If you don't have any of that, I would get an IFU as soon as possible to verify what is required for maintaining and care of this equipment and what has actually been done and done correctly and what perhaps maybe needs to be done now. So yes, go to OneSource, get the IFU.
So this next question relates to the previous question. This audience member wants to know if you have any recommendations for updated equipment necessary to address the increased airborne concerns related to the transmission of COVID-19, such as HEPA filters or UV lights.
Well, there are recommendations that are just heightened from what is already necessary. So the CDC, OSAP, they all have a list of recommendations. Even the ADA put out a great toolkit for the required or the suggested or recommended additions with the barriers. The barriers are the biggest thing. I know having patients register and be outside so you don't have a whole waiting room full of patients. Making sure that you take temperatures of patients, making sure that they follow up if they get sick in a 2-week period after the dental office. It's just maintaining or just heightening those requirements that are already established within your practice. The barriers are great. Now, I know CDC and ADA have stated that they want 15 minutes. After the patient leaves an operatory, you should wait 15 minutes to allow all aerosols to settle and then clean the room. Well, just make sure you've got the proper PPEs. Make sure you have long sleeves. I've been in offices and they just said, well, we couldn't get lab coats because they're on back order, or then don't practice dentistry. If you can't have the correct PPEs in your practice to see patients during this pandemic, you really shouldn't be seeing patients. But I've heard that it has gotten better. So it depends on where you are and what part of the country. And I know some of the states are now rolling back their phase 2, who can be seen. But you are in your dental office, you need to see those patients that need to be seen, that it's not necessarily, well, it's emergency, if you will, or if it's going to affect the dental health and welfare of the patient, to let it go. So just make sure you're taking the proper precautions. Go and get the list from the toolkit from the ADA, or even go to CDC, because they too have the same recommendations. But the biggest thing is your PPEs, your barriers, and patient information.
Thank you for that informative response to a great question. We also have another question about the current pandemic. This audience member would like to know if you have or know of any resources to find guidelines for performing dental cases in a multi-specialty ASC. The audience member said that the COVID crisis has caused their center to suspend dental procedures because ORs are positive pressure areas.
Yep, that is correct. Whoever brought that up is correct. And I don't know which state you're in. So the best recommendation that I can give to you, or the best advice I can give to you, is you need to go to your state dental board and see what their recommendations are, because each state will differ because of the spiking virus happening right now. So to answer that question, especially in multi-practice, the reason they had allowed dentists to do emergency treatments is to keep people out of the emergency room. So I know that you're a multi-practice and the hospitals have positive and negative pressure rooms, but if you are a specific office within the hospital, you need to speak to the state that you're practicing in to see what they're recommending or what they're mandating at this point.
Another audience member asked a pretty similar question, and I think you already touched on it, but just to clarify, this question asked, when it comes to sterilizing low-speed motors between patients, is it not the state laws that dictate it and not the CDC? So I think they're asking, the state laws are those that dictate it and not the CDC, correct?
Okay, so it became federal law. It was found by the CDC that potentially infectious materials remained in the motors. You have to, this is a new law. This isn't by state, this is the CDC has put it out there, and then it became law that you can no longer disinfect slow speeds. It is one of the biggest breaches of dentistry at the time, other than before this COVID-19 arrived. But it was a difficult transition for dentists. I know it was especially expensive transition for dentists. And I know that there were dentists that were looking to say, well, my IFU says I have to disinfect it. Well, that IFU is no valid, because if you're not sterilizing your slow speed, you are breaching, you're breaking the law.
Okay, that's very helpful. Thank you. It looks like we have time for one more question. So this audience member wants to know, what is the guidance about charging additional PPE fees to patients, whether insured or uninsured, to cover these costs?
Well, the ADA did approve that. I know it went in front of the ADA to approve additional costs, and it goes between $15 and $25 per person for the additional PPEs that dentists are using. Unfortunately, like I have said over and over again, these precautions you're taking, these standards that you're putting in your practice, they should already be there. You are just heightening you're just tightening up what should already be done. Now, I got it. You have to have an N95 or a double mask, or you have a mask and then you have the full mask on top of your mask. I understand that it has increased some of your PPEs, but we're all in this together. So yes, to answer your question, the ADA approved that, and you can do that, but you should be having all of these controls in your practice, whether they're work practice controls, which is how you're doing your work. How are you washing your hands? How are you implementing your standard precautions? What are you doing for engineering controls? These are just heightened recommendations that they're making to keep the staff and patients safe from transmitting this coronavirus.
Well, thank you so much, Mary Beth. That is all we have time for today. Mary Beth, do you have any final thoughts?
No, if anybody has any questions, I'm telling you, you need to get your manufacturer's instructions. I know dentistry is not as familiar with instructions for use as healthcare is. I work with both entities, and it's just to validate, verify what you're doing, and keep yourself safe out there. And thank you for joining me.
Yeah, thank you so much for your excellent presentation and to OneSource for sponsoring today's webinar. Enjoy the rest of your day, and we look forward to having you join us for future webinars.
Thank you.